persistent depressed mood. Feeling depressed for most of the day for a period of at least 2 weeks solid is one of the key criteria for the diagnosis of MDD. This period is called a depressive episode, and it can be triggered by an upsetting event. There is also untriggering, but there is no clear reason for this occurring. If you are feeling unusually sad, hopeless, empty, and demotivated for weeks on end, this may be a clear sign of having a mood disorder. 2. Inability to feel pleasure. What's an activity you do that always gives you joy? That's something that can make your whole day better. For me, it's that sweet, sweet unwrapping of a new game and watching the intro. So, what's going on when you do your thing, but now you feel nothing? Unfortunately, this means anhedonia has arrived. Anhedonia is defined as the inability to feel pleasure, and it's one of the core characteristics of major depressive disorder. This means that on top of feeling depressed most of the time with MDD, you're now also inconsolable. No event or gift can bring you up. The most you feel is flat. 3. Weight gain or loss. The more common weight fluctuation with MDD sufferers is weight loss stemming from a reduced appetite. However, there is a specific subtype of MDD called MDD with atypical features, wherein the person will start overeating and gain weight instead. Either way, MDD is known to disrupt your normal eating patterns and may lead to unhealthy eating habits such as binge eating or self-starvation. 4. Insomnia or hypersomnia. What's your sleep like? Are you good with 6 hours, or do you need 8 hours to be functional? Whatever it is, as long as you feel rested and alert, that's fine. Everyone's personal healthy sleep need is different. Unfortunately, MDD can frequently affect this too. Insomnia is constantly sleeping too little, around 1 to 3 hours per night, despite wanting to sleep and having the time for it. The other side of this is hypersomnia, one of the signs of MDD with atypical features. You sleep more than 10 hours per night and still feel unrested and tired upon waking. 5. Overfatigue with loss of energy. Do you feel exhausted all the time despite doing almost nothing every day? Do simple activities like brushing your teeth or saying a quick hello feel like climbing a mountain? This kind of overfatigue and low energy is characteristic of those afflicted with major depressive disorder. Depression sufferers of many types typically have no drive to do anything and feel constantly tired despite doing nothing. The result is usually resignation, staying in bed all day and staring at nothing. 6. Feelings of worthlessness and guilt. We can all feel guilty at times and also very upset with ourselves for making mistakes. That's normal. However, has your self-esteem suddenly and dramatically plummeted? Do you feel racked with painful guilt at your smallest mistakes or even things not in your control? MDD makes regular guilt and self-checking into overwhelming emotions. Activities like writing or speaking to a friend could be helpful. If they aren't, seeing a professional can let you know if there's something more serious behind it. 7. Difficulty thinking and concentrating. This sign is likely a consequence of having low energy and little motivation to do anything. In simpler terms, since there's no motivation, you don't care enough about something to concentrate on it. Studies found that patients with MDD have poorer memory, become less focused and attentive, and have difficulty making decisions on their own. 8. Recurrent suicidal ideation. Last on this list, but perhaps most seriously, those with MDD often have recurrent thoughts about suicide. Depression can feel so overwhelmingly torturous, isolating, and dark that it may seem like the only way to stop the pain is to end the life living it. Depression may be seen as common, but that does not mean that it is in any way easy.
Keep it a secret. Reaching out to the people you love and building a support system to help you in your struggle against depression is a wise choice to begin with. Many people suffer in silence, keeping their mental illness a secret because either they're in denial, ashamed of it, or think they can conquer it on their own. And while you might be convinced that you're doing everyone else a favor by keeping your problems to yourself, it isn't true. Depression isn't something that should ever be kept a secret. 2. Drink alcohol. Do you often drown your sorrows with alcohol? While drinking might help you numb what you're feeling right now, there's a very high possibility of you becoming dependent on it the more you use it to numb your depression. In fact, alcoholism and substance abuse is common among those suffering from depression, so don't just trade in one problem for another. 3. Isolate yourself. Do you have the constant urge to push people away? Do you lock yourself up in your room all day? Depression may make you believe that you need to be on your own all the time and that no one wants to be around you. But in reality, that isn't true. There are people out there who care about you. Your relationships and social activities can help curb the intense feelings of loneliness and emptiness that depression often brings with it. 4. Blame yourself. Do you often blame yourself for being depressed? If you do, we're here to tell you that it's not your fault. It can happen to just about anyone. So don't beat yourself up for feeling this way. There are dozens of different reasons outside of your control that might be making you depressed, whether it's because of your genes, your brain chemistry, your upbringing, or your environment. So don't think that any of this is your fault. 5. Neglect your self-care. Have you been laying on the sofa binge watching movies on Netflix the whole day? When was the last time you went for a jog or had your nails done? Yes, depression can make you lose interest in the things you once enjoyed. But the thing is, taking care of your physical health can make a world of difference in alleviating your stress and helping you cope with your depression. The appropriate amount of sleep, exercise, and healthy eating can help you feel better. 6. Let it define you. Did you know that your therapist never refers to you as depressed, but rather as someone with depression? There's actually a very good reason behind it. Because mental health care professionals believe that you shouldn't be defined by your mental illness. You're more than your diagnosis. Depression changes you in a lot of painful ways. It affects the way you view yourself and the world around you. But it's important to never lose sight of the person you are without it. So remind yourself of all the wonderful qualities that make you who you are, and don't let depression stop you from doing the things you love or going after your dreams.
Many adults find relief from depression symptoms by taking oral antidepressants, starting talk therapy, and changing their lifestyle. For those taking medication who have tried multiple courses of antidepressants of adequate dosage and duration without a satisfactory reduction in symptoms, their doctor may refer to their condition as treatment-resistant depression, or TRD, and should explore additional treatment options with their doctor.
There is no one cause of MDD, and although we still don't understand which treatments will work for any one individual, the good news is that there are many options to explore.